Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Emily Grooms, Manager of Clinical Informatics at Goshen Health, to talk about how her team is improving sepsis identification and care through AI and workflow innovation. Thanks for being here today, Emily.
Thank you for having me.
Before we get started, let's just kick off with a little bit about your background in nursing and clinical informatics.
Yes, I started my nursing career on the cardiac and stroke units and then spent some time travel nursing, really experiencing nursing across the country. I later landed in the quality improvement roles in Texas working on stroke and heart attack care, and then transitioned back to Indiana to focus on performance improvement in trauma care. So I finally landed here at Goshen where our key drivers focus on process improvement. So not only do I get to work with data quality and reporting, but I actually get to focus on process improvement and making improvements for our patients.
That's wonderful. And, focusing on sepsis specifically today, we know that this remains one of the most time-sensitive and challenging conditions to manage. What were some of the barriers Goshen Health faced in identifying and managing sepsis early on?
Yes, so our clinicians are trained to understand sepsis as an emergency. The difficulty for them is taking that clinical knowledge and applying it in a real-world setting, in a busy emergency department. And so there's a lot of very complex details that are involved in the quality measure regarding sepsis. And having them understand those in general, when one measure takes several pages of details just to describe how to abstract that measure, it is very difficult for those providers to use that in real time to even get the definition right. And the onset time is what drives all of the sepsis care. So they may understand onset of sepsis, but identifying it in real time is really, really difficult. The second thing that I would say was a barrier, or at least a difficulty, is surrounding the idea of communication. Identification, once it's identified, we really know what to do, but it's in the communication to all of the team members where the struggles lie. If one person knows what's going on but doesn't share it with others, then it's hard for them to collaborate and make sure that all of the things are done within the timely manner.
And so to improve sepsis management overall, your team implemented a quality improvement project using rule-based AI. Tell me a little bit about what that looks like in practice today.
Yes, so the rule-based system monitors for the clinical elements that would indicate severe sepsis onset. It monitors that 24/7, 365 so that our clinicians are not having to spend time digging through the chart to put all of the pieces of the puzzle together. They are fed the information in near real time when those events are occurring so that then they can then evaluate that and take action if appropriate.
And, AI is only as effective as the workflow around it. So how did you ensure that the alerts were actionable and really supported by the clinical teams?
We did a lot of validating prior to implementing this project to make sure that first the alerts were informed by good clinical data, that our clinical data was timely and it was as clean as possible. And then we would validate that data against our abstracted cases to make sure that we were getting actionable alerts and not a lot of fluff because of inaccurate or untimely documentation. And once that data was validated, then we rolled out the process improvement project. Using this project, we did make sure to have the clinicians understand that this is casting a wide net so that we do not miss our patients that need this timely care. We wanted to make sure that, yes, it's casting a wide net, but you do have a clinical judgment to make sure that it is capturing who you need and that you can take action on who you think is appropriate.
And the results of this project really were remarkable. Tell me a little bit about the outcomes that you saw after implementing AI in this workflow solution.
Absolutely. We have seen a tremendous impact on our SEP1 bundle compliance over the course of several years. It has given our clinicians actionable data to say this is somebody that you need to take action on. And not only is it actionable, but it's actionable for patients that have not progressed to septic shock yet. Yes, those patients are easy to identify and pretty easy to start the bundle elements on. It's the patients that are not that sick but still need these interventions in a timely manner so they do not progress to that. So this decrease in mortality without a length of stay increase means that we are helping people reduce the risk of septic shock without having to stay in the hospital longer.
Well, Emily, that really is, these results are incredible, and it's really great to hear that the patient impact is as positive as it has been, because sometimes it's easy to lose sight of why we're doing all this, and the patient at the end of it is why we are. So what advice might you give to other healthcare leaders or clinicians who are looking to introduce AI-driven tools into patient care safely and effectively?
I would say the first thing that clinicians should consider is data validation prior to starting the project. This is a great tool, but it does need some time to make sure that the data that it's being fed is accurate and also timely. And if those processes are not in place prior to implementation, we're going to be feeding our clinicians inactionable data, and they will get frustrated, and it will be more difficult to continue with process improvement when they're already frustrated with the tool. My second recommendation would be to focus on education. Providers are generally trained on sepsis identification and treatment. However, they are not trained on the intricacies of the bundle elements and the details that go into sepsis identification. So helping them understand the nuances to sepsis identification really helped with buy-in from those clinicians, so that they felt like this system was really helping them hone their skills and hone that identification down to the appropriate patient population, specifically because we are focusing largely on not the sickest and the worst patients, but trying to capture the patients that haven't progressed that far yet. Finally, I would focus on using the tool as a collaboration tool. Again, this is just a tool. This is information that is delivered to clinicians so that they can make informed decisions and take appropriate actions. And so recognizing how this is a collaborative effort and this tool is one piece of that is extremely important, not only for the clinicians and the physicians, but also for the nurses, how the nurses are able to receive the same information and help collaborate care across the continuum so that all of the bundle elements can be addressed, not just the first portion.
Emily, thank you so much for the insight today, for being here, and for the great conversation, and of course for the continued partnership with Inovalon.
I appreciate you having me here.
And to our audience, thank you so much for watching. Be sure to keep an eye out for our next episode of INOvators.